working with anterior cheek volume, but placing the cannula lower and then fanning it upward is a very common technique that I'm seeing on the trainings and aesthetic conferences. But there are two main problems where I'm seeing with this cannula placement. Problem number one is arterial and venous supply. You see the infraorbital foramen is about here, and injecting from underneath, particularly deep, you have a high chance of cannulating into that space. In addition to that, transverse artery and facial vein also goes through the space where the deep injections can potentially be traumatic to those structures. Second problem is the results over time. As we know from so many clinical studies and evidences that no matter where you place your final volume, some filler is always going to backflow into the area of your pilot hole. That means that over time, the patient who you place a filler here end up with some volume sticking out in the lower cheek here, and that creates very heavy, droopy, bloated, whatever overfilled filler look that every patient is scared of. Last but not least, it is the nasolabial fat pad that is going to be very close and sometimes passed right through on your way of placing the volume, which means that over time this fat pad that is already getting bigger is going to have some filler that's going to help to accumulation of that extra volume and creating heavier nasolabial fold and heavier transition between the cheek and the upper lip. And that is why for my patients and in my trainings, when I do my anterior cheek, I do the deep volume laterally from infraorbital foramen, and then I place my cannula here and I fan it this way to fill in the anterior space. That will avoid the nasolabial fold altogether, and if it's going to backflow towards the cannula point, well, wonderful, because this is the highest point of the cheek where we want that beautiful volume, and fanning this superficially is going to avoid all the important vascular structures. Follow me for more cool aesthetic stuff and come train with me in Fort Lauderdale, Florida.